Joining us to talk about coronavirus and the headlines today and how to ride out this new wave is Dr. Syra Madad, an infectious disease epidemiologist. Thank you so much for being with us this morning, doctor.
Thank you for having me, Eva.
So you've heard us talking about this morning. Cases are going up across the country. What needs to happen right now to get a handle on this? Do we have a handle on this at this point?
We absolutely do not have a handle on the COVID-19 pandemic here in the United States. You're seeing alarming number of increases in hospitalizations, cases, percent positive, number of deaths are increasing. These are all indicators that are all going in the wrong direction. And what we absolutely need to do is first, we need universal source control, meaning we need to have more individuals wearing a mask. We need to prioritize those activities to help curb the spread of COVID-19. So this includes looking at where people are congregating, limiting the number of people that are going to restaurants, maybe having outdoor seating. We need to really prioritize what we need to do to get a handle on this pandemic.
You said this isn't just a pandemic, it's 50 epidemics playing out differently in each of the states. Does that make this harder to get under control?
It is absolutely making it much, much harder. We have a bottom-up approach here in the United States versus a top-down approach, what we're seeing in other countries that have successfully been able to contain COVID-19. So, for example, each state is dealing with its own epidemic. And if you're looking at Vermont, you have, 2.3 cases per 100,000 over a 7-day average versus North Dakota, which has 105.5 cases per 100,000, in the past 7 days. So that shows you that each of these epidemics in these states are very different. Some are trending in the right direction, some are trending in the absolute wrong direction. And we are at very, very high case levels, coming into fall and winter, and this is only going to get worse. So we absolutely need to see, how we can try to get a handle on COVID-19, because this is going to be with us for quite some time, and this is going to be the most difficult months for the American people.
We've been fighting this virus for many months now. What have we learned? What have scientists and doctors learned that will help us heading into these colder winter months?
We have learned a lot, and it's some of the most basic things that you're constantly hearing. We need to limit the number of people that are congregating. We need better ventilation if they're coming together indoors, mask use, washing hands, socially distance. These are not magic interventions, but they're interventions that are tried and true, and they work. So we really need to make sure that we are continuing these measures. And as we're heading into very difficult months, I think people need to also start looking at how they can prepare themselves, having an in-home emergency kit, because now what you're going to see is a more hyper-local response. You may have to shelter in place if the cases continue to increase in your given location. So really important to start preparing now, looking at who you want in your social bubble, staying informed, staying healthy. These are the things that people need to start looking at and doing, along with all these preventative measures to help ride out the fall and winter wave that we're currently in.
Dr. Madad, some good advice for us this morning. We appreciate your time.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.